Opportunity to once again lead the provincial government of Surigao del Norte. And indeed, I have been working hard because I know the people of my province are worthy of a leadership that prioritizes their welfare. Isa ka liderato na responsable, likon, sincero, sanan may baruganan para maihatag ang tinuoray na kalambuan sa ato probinsya o sa mga Surigaonon. Amidst the challenges brought about by the pandemic and Super Typhoon Odette, my administration aims to move forward ensuring real, tangible, inclusive, and sustainable progress, thereby renewing the trust and confidence of Surigaonons in the government. As I took my oath of office, I introduced the priority areas where development efforts could be implemented. We have crafted the provincial development framework, aligning our agenda to the provincial, regional, and national vision. This afternoon, it is my privilege to report to you the key achievements of my 10-point development agenda for my first 100 days in service in celebration of the local government code anniversary. A manifestation of commitment and dedication to provide transparent, accountable, and non-corrupt governance to the people. This administration gives paramount focus on providing inclusive health services as we continue to support the attainment of the Global Sustainable Development Goal number 3, good health and well-being of our people. Anchored on this goal, we intensified our programs, projects, and activities for health under the first 100 days of my administration. Aside from ensuring the services and operations of our provincial hospital and district hospitals, we opened the Nepro Synergy Dialysis Center to provide essential services for our individuals undergoing dialysis procedure. We completed the staffing of our Medical Social Services Office at the provincial hospital to ensure the thorough assessment of patients availing of our medical assistance program. We were able to provide the much needed doctors to various health facilities throughout the province. The province received a prefabricated container van donated by United Nations Population Fund, or UNFA, complete with amenities to serve as the Women and Children Protection Unit at the provincial hospital. This now serves as a safe haven for the violence against women and children and gender-based violence survivors. In addition, our COVID isolation building at the provincial hospital was recently inaugurated to accommodate COVID-19 cases, pulmonary tuberculosis cases, and other transmissible diseases. Since July 1, our doctors at the provincial hospital have treated a total of 4,830 patients, 1,197 of which were admitted, 18 underwent major surgeries, and 129 underwent minor surgeries. The rest were able to avail of our diagnostic, laboratory, dental, and outpatient services. As promised during my inaugural address, these were all subsidized under our medical assistance to indigent patients program in partnership with PhilHealth, amounting to 8.75 million to attain the zero balance billing for every patient. Moreover, we recently launched the provincial hospital as a consulta provider, the first health facility in the entire Caraga region to be accredited of this PhilHealth program. The PhilHealth Consulta package covers individual-based health services, including initial and follow-up primary care consultations, health screening, and diagnostics. I am glad that with the help of PhilHealth, we also now have the electronic KULSA web-based application, which can accommodate at least 20 Surigao loans per day. This system could be used to encode data records, diagnosis, diagnostic testing, and prescribe or dispense medicines. Last September 27, the Governor's Extension Office in Dapa received disaster response COVID-19 vaccination supplies and equipment from USA, which included rapid antigen test kits, laptop computers, infrared thermal scanners, canopy tents, and generator sets. We have started the distribution of these items to the different municipalities in Surigao, with the mainland municipalities scheduled to receive their allocations within this month. Additionally, 10 processors and 9 social mobilizers were deployed in selected rural health units as human resource support. Recognizing the fact that we are still under the threat of the COVID-19 pandemic and giving no place for complacency, we strengthened our drive for COVID-19 vaccinations through radio plugs and information, education, communication program in our community visits. In support to the national government's Bakunahang Bayan Pinas Lakas special COVID-19 vaccination days program, and to bring the vaccines closer to the people, we conducted mobile vaccinations and adopted the settings-based approach to make it more accessible to the people. Under the vaccination drive conducted in the provincial capital compound, an additional 327 employees of the provincial capital and Hall of Justice availed of our free vaccines. We have also extended incentives to our vaccinees, especially to our senior citizens in the communities, to increase vaccine uptake. Still challenged to reach more of our population, we held coordination meetings with our active partner NGOs to support our vaccination campaign in priority areas. Aside from the COVID-19 vaccination, we also have our Him Surigao Pupo o Kuya Pabakuna Kamo program, offering different health services in the far-flung areas. A community-based service delivery in Sitio Kapihan, Socorro was also carried out. Our bloodletting activities also continued throughout the province under the period of my first 100 days in support of the National Voluntary Blood Services Program. With sincere appreciation to the Caraga Regional Hospitals, or hospital rather, commitment in providing us with quality healthcare services, I am happy to share that finally, after more than 20 years of occupying the lot owned by the provincial government, the title of the lot has already been turned over to the Caraga Regional Hospital. This is just the beginning of my administration strengthening of the provision of quality healthcare services for all. We just passed the mark of my first 100 days in office, and there is still a lot to accomplish, such as the reestablishment of our district hospitals to operate 24/7, fully staffed, properly equipped, and with ample supplies of medicine to cater to medical emergencies, needs and concerns of Suriganos. I will do my best also to push for the rationalization of the salaries, wages, and benefits of all healthcare workers and frontliners. As of this moment, while giving you my 100 days report, we are conducting a medical outreach program for BHWs in Surigao Island who will receive medical workup, multivitamins, medicines, and chest x-ray. One of the priorities of the national government under the administration of President Bongbong Marcos is to ensure food security. I have given more than 100% of my commitment in supporting this. With this in mind, we have included the implementation of the Productive Agricultural Program as our second agenda. We have started immediately in the work of empowering our farmers and fisher folks, our primary stakeholders and providers of the food we eat. We convened the Provincial Agricultural and Fishery Council and conducted a dialogue with the municipal agriculturists of the different municipalities of the province for the reactivation of their municipal agricultural and fishery councils. With this initiative, the council will serve as the voices and bridges of the local agriculture and fisheries sector. We also supported the agricultural development planning of the Department of Agriculture, which was attended by no less than our 2nd District Representative, Congressman Ace Barbers, and local chief executives and officials of the different municipalities to strengthen collaboration between the Department of Agriculture and the local government units. We also recently conducted the Joint Provincial Rice Farmers and Fisher Folks Congress, aimed to strengthen stakeholders' engagements for the rice and fishery industry. To further empower our farmers and fisher folks, we provided them with technology demonstrations, farming and fishing input, farm machineries, and also extended fuel subsidy vouchers and fertilizer discount vouchers with the Department of Agriculture. A series of training on aquaculture and deputation of fishery wardens and enforcers were conducted, as well as remote learning through the provincial government School on Air and Bahandi sa Kaumahan radio programs.